Hi y'all, welcome to this channel where we discuss everything related to the COVID-19 pandemic as caused by the SARS-CoV-2 virus. Today is December 2nd, 2020, and as of today, tracking the COVID cases across the world and across the United States based on the Johns Hopkins Coronavirus Resource Center. Globally, there have been 64,400,000, almost 470,000 confirmed cases and over 1,492,000 deaths. In the US, as of today, we have 13,919,000 confirmed cases, and as of yesterday, we had surpassed 270,000 deaths as of December 1st. Here, December 2nd, we are at 273,368 deaths. New cases for today have increased by 180,000 new cases. So we're hearing on the news a lot today about projected cases, the CDC saying by February we may be at 450,000 or 500,000 deaths in the United States. And I want to take some time to just make a sense of what does that actually mean. So here I'm at the cdc.gov coronavirus website. I'll put links to everything I talk about today in the description below. But what they're really talking about are forecasts. And these are forecast models based on trends that we see of new deaths, new weekly deaths in the black line here. And depending on which model they use, and every model has certain assumptions, and they're run by different academic institutions, different organizations, epidemiology groups. And you can see all the different colors here are different models that are used to project what future deaths could be. And the color smattering here, that it's a very wide range of where this could go. The latest information is right here, probably here, December 1st or 2nd, and some of this is even projected from earlier days. But let's say we are here around December 2nd. Right? The new deaths could go drastically up, higher, depending on how people react and how social distancing, how people handle the holidays, or it can come down and start to level off. And so there's a wide range of where this could go, and the numbers that you sort of see in the news is probably more here on the right. This is the CDC ensemble, so they kind of collect all the different models and all the different projections together and blend them into what are sort of the ensemble models with somewhat confidence interval bands around that. And if you take the sort of the midpoint, that's the red line in the middle, where all these models sort of average out for the sake of argument. We're seeing that by the middle of December, just after December 15th, we're probably going to cross the 300,000 death mark, and that's more near term. But there could be much higher cases, or there could be lower cases, depending on how the nation and different regions of the nation react and operate over the next few weeks. So I think what the news is picking up is, if you extend this line into February, so every dot here is a week. So between December 15th and February, call it mid-February, you're talking about 8 to 10 weeks. So 8 or 10 dots further, where will this end up? And if you kind of drew the curve, it probably does end up around 500,000. But I think that's also assuming everything is increasing at the same rate. If we are able to sort of bend the curve, people do practice social distancing, masks, hygiene, and to ensure that COVID doesn't spread further. We could see the deaths start to plateau, in which case by February, hopefully we could be closer to 300,000 as opposed to 500,000. So I think there are multiple ways this can play out, and time will tell, and a lot of it can be influenced by how we as a society act and react. But that's just to give some sense of some of the headlines you may see in the news, what that really means. And when they refer to the CDC saying a certain number, it's really a midpoint or a possibility of a number of possibilities across a range of possibilities. And they're kind of isolating a single number where the ranges could be, it could be really high as well, but it could also be much lower. So it just depends where we go from here. All right, so the other way to look at this in terms of where we are today, this is a graph now showing total deaths in the United States compared to with other countries as well. So as of today, December 2nd, we are just over 270,000 deaths, around 273,000 deaths. This next curve in the purple, that's the European Union. Let's see that here. The European Union is just about at the same number, roughly 270,000 deaths or so. So this is probably the line to be aware of. Right now it looks quite linear, meaning it's increasing in a straight line fashion. What we want to see is this curve flatten, and that means lessening of new deaths. So therefore this is total deaths, and total deaths hopefully could stay stable. But if this curve doesn't flatten and continues to sort of hockey stick up, which we saw recently in the European Union, it's purple, then we could be in much dire straits, let's say by February. So that just gives a sense of where we are today, and try to make sense of some of the news that's out there. Anything that is a forecast is a projection based on a lot of assumptions and a lot of models. I'm not saying they're right or wrong, but they are forecasts. And to be optimistic, there are many things that we can do to bend the curve, flatten the curve, and change how these models play out over time. So that's really it for this video. I just want to give some perspective as to some of the news. Unfortunately, as of December 1st, we did, in the United States, hit 270,000 deaths. And if you look at from my last video, just before Thanksgiving is when we had 260,000 deaths. So we added over 10,000 deaths in about a week's time. That's it for this video. Thanks for watching. Stay safe. And remember, wash your hands, social distance, and wear a mask. We're all in this together.